Hi everybody and welcome to the news from the ANU Medical School from today, the 17th of the 7th, 2020. As you would have seen from my emails, anybody who has been in Melbourne or has returned from Victoria on the 6th or the 8th of July must quarantine themselves for 14 days. In addition, there have been certain hotspots identified in Sydney and some dates, and those of you who have been in those hotspots on those dates also need to quarantine yourselves for 14 days. Please contact ACT Health and inform them about your quarantining situation. In addition, anybody who lives with somebody who has to quarantine themselves should please also ring ACT Health to discuss their living circumstances. This is really to work out what the separation between the person who lives in the household and the person who has to quarantine themselves is, and whether it is okay for a health professional to continue to go to work, and this will be the same for the students as well. Anybody who's been in contact with people quarantining themselves do not need to do anything else, but just remain vigilant and monitor their health. And if you have any symptoms, please see a GP or get tested at the testing centres. As the advice changes regularly, please check the ACT COVID-19 website for more information. The Canberra Health Emergency Coordination Centre has developed a digital screening tool. You will also find more information on the ACT COVID-19 website on this. This is a tool that very soon every person will have to fill in every day for every health facility that they visit. Filling in this tool is very easy. You can either do it online or you can scan the QR code on the posters that are around. Take a screenshot of the green tick that you will hopefully receive and show that at the entrance to a security guard or to whomever has been tasked to check that. This is not mandatory for staff and students yet, but will most likely become mandatory in the very near future, possibly as early as next week. We will send you information how this checking will occur in Building 4 and at Calvary Hospital as soon as we've worked out the processes. It's a good idea to familiarise yourself with this tool yet and just fill it out. It's very easy to do, and it's a great way of reminding people of when they should stay away or when they need to get screened. As I've already said, if you have travelled from Victoria or the Sydney hotspots, please let us know. And for those of you who do not need to come back to the ACT right now, please do not do so. Now, as you can imagine, the rules that have changed around travel from Victoria and possibly from New South Wales will affect our teaching. So for the Phase 1 students, we had planned to get all Phase 1 students back later in the year for their clinical skills teaching, and we're amending that plan at the moment. So for those students who are not in the ACT, don't panic. We're working on plan B, C, D, and E for you, and we'll let you know what these plans are. However, as you can imagine, we're a bit dependent on what the COVID-19 situation is in Victoria, how it develops, and how much it will affect New South Wales. If the plans change and you are not required to come back but have made some arrangements with the ANU residences, please contact us and we can help you liaise with the residences about your contract. There's no change for the Phase 2 students teaching and learning or their clinical skills learning. As you may be aware, ANU Acton campus will open up with some restrictions at the end of July. The ANU Medical School, however, will remain only partially open and will remain on Level B, which is essentially what we've done since early June. So that means most staff will continue to work from home, will possibly be on either campus sometime, but will need permission to do this. This is not different to what we've been doing for quite a while now. This does not affect any teaching and learning. We will keep this state until the end of August, but we'll reassess this mid-August, which is the time when the lockdown of Victoria will be reassessed again. And the latest news and research is about Dr. Jason Agostino, who works at the Med School and the Research School of Population Health. Jason and his team have been successful in getting 1.6 million from the Australian Government Department of Health for a study to enhance chronic disease screening and management for Aboriginal and Torres Strait Islander people. Congratulations, Jason. And in the media this week, we had Associate Professor Louise Stone in The Conversation, Professor Peter Collignon in AFR, The Project, ABC Online, Canberra Times, and very busy also on Sky News Live, and Associate Professor Sanjaya Senanayake in the Daily Mail and ABC Radio Melbourne. And the spotlight on teams this week is on our fabulous Rural Clinical School. As you know, the Rural Clinical School offers students rural immersion and placements. It's been a very difficult year for staff, students, not just at the Royal Clinical Schools, but in the community because of the bushfire and the COVID-19 situation. This has required a lot of communication, support, but also flexibility and collaboration between the teams. And the Royal Clinical School really has many, many people involved, and I'd like to particularly thank every single one of them, coordinators, supervisors, clinicians, and students, to make this a very cohesive and supportive team. And as you may have seen from my email as well, this year we will offer again the ANU Medical School Directors Excellence in Teaching Award. You need to apply by end of August. Anybody can nominate anyone for this award. If you're not sure how this works, please contact Cheryl Morse at the below given email address. Once a nomination has been received and assessed, the nominee will have to apply for that nomination and nominate some referees. We'll get some references, and then there'll be a committee that will choose the recipient for this year, and the recipient will be announced at the end of year faculty meeting. So think about who really deserves such an award and nominate them for this award, because it is important that we really praise and cherish and talk about those of us who are excellent in teaching. I look forward to your nominations. And you may have also seen an email from our IT team. Those of you who use Cisco for remote access through the VPN system will have to change and will have to use a product that's called Global Protect. VoiceLove and his team have sent out some information on that. Cisco will be decommissioned today on the 17th of the 7th. If you have any questions or you're not really sure what to do or how to do this, please contact the medical school IT team. And as announced earlier, on Tuesday, the 21st of the 7th at 5:30, the Dean of the College, Professor Gruen, will hold a town hall meeting for the medical school. We'll be co-hosting this together, and Professor Gruen will be talking briefly about ANU and the effects of COVID-19 on the university. Also update you and transform, particularly how it pertains to the medical school and how we can explore future opportunities for the medical school, and a little bit about the budget implications for this year and for next year. As I said, you should have all have the invitation and Zoom details, and please feel free to come along and ask Russell any question that you have to these topics. There will also be a bushfire relief fundraiser held on the 27th of the 7th at 6 o'clock, and you need to register for that. Details were in the Starve newsletter. And that's all from me for this week. I hope you're well and stay well. Please continue to follow the COVID testing guidelines and try to keep up to date with the ever-changing rules around travel and monitoring. I try to keep you updated as much as I can, but it does change quite frequently. Please look after yourselves, your friends, and your family. Email me with any ideas and suggestions. Have a great weekend, and I shall see you next week. Bye-bye.